which Governor Dayton and I certainly share, know that it is those people that benefit the most. This morning I was just heard about a Dakota County.
We must start using the power of our own voice. Our voice is loud.
You serve, and I want to thank you for all of your tremendous dedicated work to take care of people throughout our state who are in need or who are not able to take care of themselves. I worked 3 summers in high school as an orderly in the emergency room and then surgery at the former Abbott Hospital. Both of my sons were born after extensive labor in Abbott Northwestern, and that's why I say that, and I put it on one of your signs last year when we were getting ready for some possible issues which fortunately didn't come to pass. I wrote that doctors are important, nurses are essential. I applaud all of you, and I hope you give yourselves a round of applause for what you do every day. Every night. It is a partnership, of course, with doctors and others in the healthcare profession, but what you do is just essential. And to provide the care that you do, day after day, night after night, with the dedication, the professionalism, the commitment is one of the great strengths of our state. The quality of our healthcare, the quality of care provided to all of our citizens. And it was in that spirit that I said the easiest decision that I had to make my first 2 months as governor was to sign the early opt-in for MA, and I did so knowing that it was going to benefit some 95,000 Minnesotans with better quality health care, and also importantly, it was going to provide the financial resources from the federal government necessary to allow hospitals, especially in greater Minnesota, some in serious financial straits, clinics, doctors and nurses to provide the quality health care and being reimbursed for that health care in ways that strengthen our economies, especially in greater Minnesota, and your wages and doctors' wages and all the others that are provided with that federal money is spent in local economies throughout our state, which is why the Minnesota Chamber and why the Minnesota Hospital Association, the Minnesota Medical Association, the Minnesota Nurses Association, by everybody involved in providing health care. People in Minnesota supported doing it, which, as I said, made it the easiest decision I've had to make over the last 2 months. And with Representative Thiessen and other support, will assure that you're enabled to provide that kind of quality health care. And the other important consideration, which was just disclosed yesterday with the new budget forecast, is that the early opt-in for Medicaid and the implementation of that, combined with other factors related to the federal reimbursement, saved Minnesota taxpayers $173 million, the $165 million this year. And the credit for that belongs entirely to Commissioner Cindy Jessen, the Commissioner of the Department of Entirely. He took on a huge responsibility to take on one of our most important state agencies and one of those with some of the most significant management challenges that she walked into face, including the prediction it was going to take 9 months for the Medicaid opt-in, which Commissioner Jessen and I and Representative Thiessen and so many others found to be totally unacceptable and has proven to be totally unnecessary. And so today we're celebrating on March 1st the beginning. Less than 2 months after I signed the order, less than 2 months from the beginning of early opt-in.